I invite you to imagine a child sitting quietly in her classroom, her hand pressed against her stomach, not from hunger, not from lack of medicine, but from the very water meant to sustain her. According to the World Health Organization, an estimated 1.4 million deaths every year could be prevented through improved access to water, sanitation, and hygiene. Behind these numbers are real faces. During my humanitarian medical mission in rural communities in Central America, I visited schools with no clean water for hand washing, no proper sanitation facilities, no running water, only large containers filled with contaminated sources. We treated children and parents suffering from repeated diarrheal infections. Almost every patient received medication for parasites. When water is scarce, families are forced to drink from unsafe sources. Scarcity drives outbreaks of cholera, typhoid, hepatitis A, and parasitic infections. Diarrheal disease alone causes approximately 829,000 deaths annually, mostly among young children, and it is preventable. Unsafe drinking water fuels preventable disease, leading to repeated infection, malnutrition, stunning, cognitive decline, and long-term economic hardship, trapping families in cycles of poor health and poverty. Health facilities themselves are not immune. In water-stressed regions, hospitals and clinics operate without reliable running water, compromising infection prevention, sterilization, and safe childbirth. Without clean water, even healthcare becomes unsafe. The crisis does not end with scarcity. Too much water can be just as deadly. Flooding and rising water levels create stagnant pools, breeding grounds for mosquitoes, accelerating malaria and other vector-borne diseases. We are facing a dual burden. Water, whether scarce or excessive, becomes a driver of vulnerability. In Malawi, through United Voices for Global Impact, we empower women and youth with knowledge on hygiene, sanitation, and water protection, strengthening community accountability. When women lead, communities thrive. When youth are informed, they become advocates for change. But awareness must be matched with action. The evidence is clear. Universal basic hand washing services in the world's least developed countries could be achieved with an investment of less than $1 per person per year. The return on investment is substantial. Reduce healthcare expenditures, increase workforce productivity, improve school attendance, and strengthen outbreak resilience. This is not a question of feasibility, it's a question of prioritization. As we move toward the 2026 UN International Year of Water and Gender Equality and advance SDG 6, progress toward universal access by 2030 remains off track. Accelerated financing, regulatory alignment with World Health Organization water quality standards, climate resilient systems, and data-driven health monitoring are urgently needed. We must remember, behind every policy discussion is a child missing school. A mother is walking miles carrying unsafe water, and a community facing preventable illness. Safe water is not a development aspiration, it is a public health imperative. It is educational continuity and economic stability. It is dignity and survival, and it is central to achieving gender equality and sustainable development. The policy choice before us is clear. Invest upstream in prevention or continue paying downstream in crisis response.